yesterday, we smashed it, which is a fantastic result, Queenslanders. Our previous record was 35,357 tests. In the last 24-hour period, we tested 51,479 samples, breaking past that record, breaking past that goal that the Chief Health Officer set for us. And so let's keep it up, Queensland. Let's keep that testing rate high. That's one of the things that will allow us to get out of lockdown as quickly as possible. We now have 5,844 people, at least 5,844 people subject to home quarantine directions, 9,598 people in total in quarantine, and we expect those numbers are actually higher. And so I want to thank everyone from Noosa and the Sunshine Coast to the Gold Coast and all 11 LGAs. The data that we're receiving is suggesting that people are complying with this lockdown by and large. Traffic data, public transport data, and the police data from their random intercepts has all indicated a reduction in the number of people moving around the region, and that means a reduction in the risk of the virus moving around the region. We are still seeing some people going out to shop or to browse for non-essential reasons, and while there is an exemption to allow people to leave their homes to get essential groceries and medicines, that does not extend to other discretionary items. It has to be essential, and the onus is on the individual to have a reason to leave their home, not on retailers or businesses. Now is not the time to buy outdoor furniture. There will be time before summer to get sun lounges. And I just remind everyone that the law, the health directions and the law set a minimum requirement, but like most things, we expect people to operate at a level above what is the bare minimum legal requirement. And so I urge everybody, again, to consider whether the reason they are leaving their home is absolutely essential, and if it's not, please put it off. We hope that this is just 5 more days, but every time someone leaves their home, they increase the risk that this lockdown may need to go on longer. We are, though, starting to see some early signs that the lockdown is working. We know, for example, that 2 of the cases we're reporting today had 0 days infectious in the community, meaning that there's no risk that they have infected other people not in quarantine. And that's ultimately what this lockdown is about, getting to the point where we are confident that nobody who is confirmed as positive could have infected others who are not in quarantine. While it's not in our immediate frame of concern, we continue to monitor the situation in other states. New South Wales is beginning to report transmission outside of Sydney, including as far north as Coffs Harbour, but not yet in the border zone. I understand Victoria is now recording 0 cases, which is a fantastic result for them. Of course, that's great news, and we hope to be there here in Queensland as soon as we possibly can. With the ECA cancelled, and the likelihood that we will still see some restrictions in Brisbane next week, we've made the decision to cancel the Brisbane ECA public holiday on Wednesday. It will be rescheduled to sometime later in the year. We've not yet determined when. Last year, when we delayed the public holiday to create a new special long weekend, we saw Queenslanders flock to tourist destinations, spending money in our hospitality businesses, and so we'd hope to create a similar opportunity again for Queenslanders to support our local tourism operators and local hospitality businesses. We'll have more to say about that as that decision is being made. We can cancel the holiday by regulation, so we've gone ahead and done that. To create the new rescheduled holiday, we'll need to go to Parliament and pass legislation, and so that won't be able to happen until the end of August at the earliest.
Thank you, Deputy Premier. So 16 new cases out in the community related to this new Delta cluster based at Indooroopilly. So we now have 63 cases in total related to that cluster. Then we have that pilot who works up in the Cairns area guiding ships through the reef. He's a confirmed case. And then we have 2 overseas acquired cases, both in hotel quarantine. And now we have 100 active cases. So that's the most we've had in Queensland since last year's initial outbreaks. The good news, though, is of those 16 new cases related to the Indooroopilly Delta outbreak, 2 were in quarantine for their entire infectious period. 1 had 1 day out in the community, so that was during the lockdown period, so hopefully no one else was out there interacting with them. Then another person for 2 days, another person for 3 days, then 1 person for 5 days. So there will be more exposure venues going up on our website. So it is really important for anyone who lives in those 11 LGAs or who has been in those 11 LGAs in the last week to just check that you haven't been to an exposure venue, and just check every single day that there haven't been more added. The other 10 we're still working through, because here in Queensland my cut-off for when I declare numbers is 6 a.m. in the morning. So some of these were coming through during the night and I was seeing them through the night, and we don't have that information from those individuals. So that's why I can't tell you about those other 10, but of course it's all being worked on now, and as soon as we get any exposure venues related to any of those 16 people, we'll put them up on our website, so please check that, and we'll put a press release out later today. So you've heard that today's cases were again related to the Ironside State School, Indooroopilly State High. Then the remainder were all related to known cases that have been to numerous different schools that we already know about. 7 of them were family, household members, and 3 were close contacts. So we haven't got any unlinked cases due to those 16 new cases today, which is good. Now, I'm getting more confident that we don't have other chains of transmission out there that I don't know about because of the fantastic testing. 51,000 is an absolutely brilliant result. Thank you to every single person who came forward and got tested. I know that in some places there were long queues, but it is so important that you do that, because we still don't have the link between that initial family of 5 and those 2 very initial cases from the 29th of June that came from overseas, other than the whole genome sequence. So we still need to keep up that testing. Any symptoms at all, please immediately come forward and get tested. That is absolutely critical. Now, the pilot from Cairns, he was fully vaccinated with 2 doses of Pfizer back in March. So all of our pilots who go onto vessels that they pilot into our waters here in Queensland have been vaccinated. Maritime Safety Queensland did a superb job doing that, because we know they were all high risk, and this proves it. So he has acquired the Delta variant, most likely from one of those ships. So I just this morning got the whole genome sequence result back from him. It's confirmed Delta. It is not the Delta strain that is circulating in Brisbane, and it hasn't clustered with any other known case of Delta in Queensland. So now those whole genome sequence experts will go and see whether it clusters with any other case in Australia or overseas. But it's highly likely he's acquired this infection while he's been about his work piloting one of those ships. So he has very high CT values, extremely high, so that means very little virus. His family members who live in the same household as him, his partner and child, are negative, but he did take his child to a childcare centre, so that's why the childcare centre his child attends has been closed while they clean it and assess the risk there. And we've stood up a lot of additional clinics in that Cairns area, and I ask anyone who lives anywhere in that Cairns area to please look online for exposure sites, and if you have any symptoms at all, please immediately come forward and get tested. That is critical, because although I believe the risk is low, it is not zero. There is still risk there that he could have transmitted the infection. But he is fully vaccinated, and the CT values on the tests that have been done are high, so there's only a small amount of virus there, but there was enough virus to sequence. So there is enough virus there to infect someone. So that's very important. Thank you for that. So going forward, we really have a challenge here as Queenslanders, which I know we're up to, but I need your help. So I'm not a lawyer, and I've got a really good team who write directions, but of course there are gaps in those directions. I need every single person who lives in the 11 LGAs, instead of reading a direction and working out what they might be able to do under that direction, instead, when you open your front door, could you please think, do I really need to go outside my front door today? Maybe just stay home, because you can only move this virus around if the person moves around. We know that fomite transmission is very low risk. It's people that move this virus. So if you can manage to stay home, then hopefully we will be able to lift those restrictions, those stay-at-home requirements at 4 p.m. on Sunday. So I'm sure no one who lives in those 11 LGAs want to be the person that means we have to continue those restrictions beyond 4 p.m. on Sunday. So please, when you open your front door, just think for a moment, do you really need to go out? And also, and I'm a great online shopper, could you think about whether you need to do online shopping this week? Do you need those people out in the community delivering packages and things? Maybe just leave them for a week. And click and collect. Do you really need that furniture that I know you can go and click and collect, which is safer, absolutely, than going into the store, but it still means you're putting someone else at risk. So please, everyone, just think of what you could do to just stay at home for the next few days until Sunday, because it'd be really good if we could lift it. That's a big challenge though, when I look at other states and how long it's taken before they could lift their restrictions. If we don't do something really, really, really special in Queensland, we'll be extending the lockdown. So please, I ask of all of you, try your absolute hardest to stay at home if you possibly can. Of course, if you need food, go out and buy it, of course. And our supermarkets are brilliant and have systems in place, and check in, do all of those things. So this is not about you don't go out for essential goods. Of course go out for essential goods. But if it doesn't matter, genuinely, you can wait to buy that thing till next week. Just leave it. And let's see where we are on Sunday and make some more decisions then about the necessity of whatever it is. So let's go all out this week. Now, of course, there are some exceptions. If you're sick, come forward immediately and get tested. That is critical. The more testing, and thank you, those 51,000 people yesterday, just brilliant. So the more testing, and we can find cases then while we're in lockdown. That's my aim. Find any case today that we've got people in lockdown, because then it doesn't matter we've had those cases because they're in quarantine, so it won't stop us lifting the restrictions on Sunday. So please, everyone, just think of what you can do in the next few days so we can lift this and we can beat all the predictions about how long it takes to get such a large cluster under control. Thank you.
Life updates.
Firstly, a huge thank you to the 51,479 people coming forward getting tests. That is incredible. We want to see those numbers stay high over the next few days. For people coming out and getting vaccinated, if you have a booking, please continue to go to that booking and get your vaccination unless you are unwell. And of course, for those people in home quarantine now, 5,844 people, at least that number, are home quarantining right now. So if you know someone who's home quarantining, check that they're okay, give them a call, send them a text, make sure that they're ringing our 134 COVID number if they need any support whatsoever, because they must stay home other than to go get tested. We are at 63 for this cluster, the highest we've had since the first wave last year, and we're up to 100 active cases. So the next 5 days, it's up to you. Whether we extend this lockdown, whether we spread the virus to the community, that is up to each and every one of us. As Dr. Young says, don't worry about what the directives and the law says. Do you want to go out and risk getting the virus and bringing it back to your household and risk an extension of the lockdown? If we do this and we do it right over the next 5 days, it can make all the difference. And we can see Queensland coming out of a lockdown sooner than other states if we do this right over the next 5 days. So even if you are ordering stuff online, if that means someone's going to have to come to your household to deliver that, to bring stuff into your household, then if it's not essential, absolutely essential, just hold off a few days. I want to also say we've set up a number of clinics in Cairns. So for those watching and listening from Cairns today, we have Queensland Health clinics at the Cairns Hospital and Uamulla Street. They're drive-throughs. They're extended from today from 6:30 in the morning till 10 o'clock tonight and tomorrow night, and then we'll see how we go from there. There's 9 clinics, testing clinics that are being run by Cairns and Hinterland Hospital and Health Service, and there's another 20 private testing clinics also in Cairns and surrounding areas. QML are setting up a pop-up clinic opposite the Cairns Hospital today from 10 a.m. for walk-ins as well. And there's an additional private clinic at the Childcare Centre at Trinity Beach operating from 9 to 4 today. Those are for the families who are linked with that childcare centre. So please check our sites for updates and extensions to hours for sites. The new the Mogul Sports Park is open today as well. So check our website for new testing clinics, and also if you've been in those 11 LGAs or in the Cairns area, please keep checking our website for exposure sites. I'm pleased to say that I'm aware that the Pharmacy Guilds advised that 224 of their over 500 pharmacists that are seeking approval to deliver vaccines in South East Queensland have now been authorised by the Commonwealth and have put their orders in. I'm being advised that they've been told that the supplies they need, so the consumables, the syringes and so forth, and the vaccine itself will be coming next week. Now, I will be doing everything possible to fast track that. The Commonwealth has got these vaccines already. They offered them a couple of days ago, so we would hope that that 150,000 vaccines can arrive earlier than next week. And we will look at our own AZ supply and if we can redirect that to those 224 pharmacies that have approval now, and our consumables, we will do that as well. But I don't think it's acceptable that they have to wait till next week for the Commonwealth to deliver those vaccines and those consumables when they've got it in supply now, and we ask that they be delivered as soon as possible, because the sooner we start getting these vaccines in people's arms, the safer those individuals become and the safer our community becomes. Thank you.
So, ladies and gentlemen, live coverage of the press conference from Queensland Parliament.
Thank you. I will also start with a thank you to our community for the past 24 hours. We have seen a good increase in compliance right across the community. Our enforcement's down, the calls for service have been down, but nonetheless the request is still there to do better. We still are having to take too much action that we would rather not take. Yesterday we issued 48 penalty infringement notices, and that included 7 for masks and 34 for general non-compliance with the directions in terms of being out in the community when people did not have a valid reason. We also arrested 4 persons. Regrettably, these characters decided to do a break and enter at Heritage Park as well as disobeying the directions, so they've been charged with criminal offences and breaches of the health directions. We instigated our operation yesterday of increased police visibility across the southeast corner, and that included RBT-style intercepts. They will continue. We will monitor how they are tracking and increase them if we need to. I can tell you that from a sampling that we've done in some of them, for instance, 150 vehicles stopped at one on our south side. All 150 people were compliant with the directions and within the 10Ks as required of those directions, which is very encouraging. But as you've already heard this morning, it's not just about whether we can legally do it, it's about whether we should be out there. So clearly for the community, it's not just making sure that you're doing the lawful thing, make sure you are doing the right thing and only go out if you need to do that. Yesterday we also inspected 62 businesses and all were compliant. I'm going to finish off by saying thank you to the community that does alert us to these issues. We need to hear from you if there are concerns. This is not something that the police can do alone, and we do rely on the community supporting in this, and thank them for that. Thank you.
On those rules, obviously...
Press conference coming live to you from Queensland Parliament.
Sundowners, as you mentioned, if people are going to keep on doing that, will you consider implementing new rules?
The rules are pretty strict, and they require individuals to consider before they leave home whether they are leaving for one of those essential reasons. And that's the only reason you can continue to be out of the home. So you can't go out because you need milk, but stop to look at EB Games or JB Hi-Fi. So the requirements are there. The police are checking people for the first time, those RBT-style interceptions. We just urge everyone to really, just for a few more days, we hope, do the right thing. 5 more days, do the right thing, and then next week you can buy all the sun loungers you think you need.
Will the government actually clarify, though, what is an essential worker? Because there seems to be a lot of confusion around what is an essential worker, especially in retail.
Look, I'd certainly urge those businesses to reflect on how much of what they sell could be considered essential, and then take that into account. But really, the way we've implemented these restrictions right throughout the pandemic has been to put the onus on the individual to only be able to leave for those essential reasons, and that's what police are focused on enforcing.
There's a movie crew that's actually gone over to Stradbroke Island during the hard lockdown. Do you consider that essential?
Look, I'm not across the details of that. I might check with the Chief Health Officer if you're aware of. Not aware of those details, but happy if you pass them on, we can look into it.
Dr. Young, given the cases today, how are you feeling about that outcome?
I'm confident that if Queenslanders continue what they've been doing and just ramp it up a little bit, that we can get this under control by Sunday. So the amount of testing is very, very reassuring. Please continue doing that. And the fact that most people are staying at home. The data about car movements, about public transport, looking around at our communities suggests most people are staying at home. I'd just like people to reflect a little bit more about, is it essential? Because last year I didn't have any problems with Bunnings being open and people going and buying pot plants and doing some gardening, but that was with previous variants. We just need to ramp it up. This is Delta. It's so much more contagious that really we've just got to, as I say, ramp it up and really for the next 5 days think, do I really need to leave the house?
A couple of exposure sites the Gold Coast. Is there a concern about the Gold Coast and what's the link?
So there you are, ladies and gentlemen. For the next 5 days, do you really need to leave the house? And if you're not, definitely don't do it. So ladies and gentlemen, and today, as I mentioned before, we have a co-host, and welcome to the show.
Thank you so much, Umesh, for having me on the show, and I would like to congratulate all Queenslanders for having those over 51,000 tests, and they're all trying their best to keep Queenslanders safe. Thank you so much, all Queenslanders who are doing the right thing. I know that some of the people are still not doing the right thing. They shouldn't be opening all these electronic shops or the furniture shops because they are not essentials. So keep Australians safe or keep Queenslanders safe. Thank you.
But what about music stores?
No, it shouldn't be open. If real estate can't open because we have got a lot of tenants dealing with tenants, with essential people moving in and out, if we can't open, I think a lot of people shouldn't be opening their stores.
Well, ladies and gentlemen, that's there you go. You heard from Musa Chandra saying that all these stores should not be open. Right now, let's hear from Dr. Janet Young.
Hello, I'm Dr Jeanette Young. To keep Queenslanders safe from COVID-19, a lockdown is now in place for the South East. This Delta outbreak is our most concerning yet, so stay home unless absolutely essential. If you must leave home, wear a mask and keep your distance from others. If you have any symptoms at all, get tested immediately and get vaccinated when you can. If we work together, we'll slow the spread and we will save lives.
Authorised by the Queensland Government, Brisbane.
Yes, the right thing is wear the mask, get tested and get vaccinated to keep all Australians safe. So that's the message from the Chief Health Officer, and that's the message from me as well.
So it's wonderful to see that so many Queenslanders did come out and get tested. Excellent work, Queenslanders, and thanks Chandan Das for that comment there as well. Everyone who has joined online, welcome once again from sunny Brisbane. Well, the temperature outside is 17 degrees and it's looking absolutely beautiful looking out the window of our studios here. And it's good to see that the streets are a little bit less busy than it was in the last few days. I think the message is cutting across, or the message that Dr. Jeanette Young has been going on about, and our Deputy Premier yesterday even said still far too many cars on the road. Well, right now let's take a look at those 16 cases in Queensland.
Stuck at home instead of in surgery, 2 specialists who are now in isolation with their family.
We've got 4 kids and, we're both vaccinated, but I am worried that something sinister might happen to them.
Juanita Papalato is an ophthalmologist and Matthew Peters a plastic surgeon, forced into quarantine because their 2 eldest attend Brisbane Boys and Girls Grammar where COVID has spread.
For us it is a huge conundrum because we want to be able to take care of our patients who rely on us, but at the same time I think as medical professionals we're very well placed to understand the gravity of the situation.
Emergency Dr Kim Hansen is also in quarantine.
So it's really frustrating to be at home, and we know that it creates a burden both for our patients as well as a burden on our colleagues who are picking up the load.
Forcing 2 weeks of surgery to be cancelled across the region.
So 3,000 per week, 6,000 cases.
The Indooroopilly High School cluster has grown to 47, with 16 overnight. 9 are children, 1 is a neighbour. It's linked back to 2 overseas travellers, but there's a missing link about how it got into Brisbane's western suburbs.
I am still concerned, though, that we don't know how this outbreak has happened.
The lockdown order is the strictest yet, but still people are flouting the orders.
And while it's okay to go to the shop and get food, if you guys are just keeping them company, it's not allowed.
Expect to start seeing things like an RBT type interception on our roads.
And many shops are still open across the southeast, while it's only essential workers allowed to work.
If you've got a question whether you're an essential worker, then you're probably not.
The list of exposure sites continues to grow, including this Gold Coast restaurant and the Taringa Soccer Club, which is in the epicentre of the outbreak. More than 30,000 tests were done overnight, with late night and 24-hour clinics rolling out. Vaccine-wise, an army of pharmacists is now on standby to deliver 150,000 extra doses of AstraZeneca.
So we'd hope to have the most amount of people vaccinated by Christmas.
But there is a long way to go to slow the Delta variant, with the Chief Health Officer fearing we are on the verge of a large outbreak. The southeast remains in lockdown until 4 p.m. on Sunday, but that could easily be extended if numbers keep rising.
Each and every one of us can make a difference to keep 5 million Queenslanders safe.
Lexi Hamilton.
And definitely we can, and it is our duty to make sure that we do the right thing. What do you think?
Absolutely. They have to do the right thing. All these cotton on shops and other shops shouldn't be opened. They should be fined. So if the shops are not open, people won't be on the streets and they won't be driving. I've seen a lot of buses around in the area as well. So they shouldn't be all stopped. I think just to keep safe for another 4 or 5 days. Otherwise we'll have another lockdown.
And one of the alarming things is that, the new modelling shows that young people are vulnerable as well. Let's take a look at that report.
Free from quarantine for the first time in weeks, the Prime Minister released complex modelling that underpins the pathway out of the pandemic, making the case for vaccinations with continued restrictions.
We all know that the world is in a serious battle.
If Australia achieved 70% vaccination of the adult population but abandoned most COVID restrictions, there'd be hundreds of thousands of cases and almost 2,000 deaths in the first 6 months of an uncontrolled outbreak. 80% vaccination with no restrictions would still see almost 1,300 deaths.
I have no doubt that if such a scenario were to eventuate, then there are additional measures that would be taken to avert those types of outcomes.
Maintaining low-level restrictions with 70% vaccination, including localised lockdowns, quarantine, capacity limits and contact tracing, would see deaths reduced to as few as 16.
What we're proposing now is a shift in strategy.
Having focused on older Australians, it's young adults who should now be prioritised.
It's really the 20 to 39 years category who are the peak spreaders, and they will bring COVID home to their children, they will take it home to their own parents.
Which has been seen in recent outbreaks in Western Sydney and in Melbourne's north, where vaccination rates are relatively low.
This payment is put forward as a constructive idea.
The Labor leader proposing a $300 payment for everyone who is fully vaccinated by December.
This is a serious public health crisis. It's not a game show.
Insulting is being at the arse end of the medal tally when it comes to the vaccine rollout.
The main takeout today is that even when more than 2/3 of us are vaccinated, we'll continue to face significant restrictions and the odd shutdown. Treasury concluding that short and sharp...
Yes, of course, Treasury has concluded that. So, it is very, very important that we should follow those directives.
Absolutely, Devika, and I totally agree with you. Kmart and all those shops shouldn't be open. The police should look into that. And a lot of shops are still open. I know across the road from our shop, there's a couple of shops open as well. So they shouldn't be opening at all. I mean, not if real estate is not open, other shops like Kmart, that's not essential as well. So they shouldn't be opening.
I think you are just a little bit sour that real estate is not open and other shops are open. Well, right now, sorry.
Yeah, no, I mean, I totally agree with Dr. Janet Yang that if the shops are not open, people won't be on the streets, people won't be going anywhere, they'll be sitting at their homes. So that's totally not acceptable.
Now let's move on, and of course if we don't do the right thing, what's going to happen is this is going to cost Australia big time in jobs and job losses. As you can see, this is not a complete job loss, but stand down, Qantas stand downs about 2,500 staff. Let's take a look at that report.
Grounded planes due to COVID border closures and Groundhog Day for Qantas workers.
We've had to make the difficult decision to temporarily stand down around 2,500 Qantas and Jetstar employees who work in our domestic operations.
The affected Qantas frontline staff, including pilots and cabin crew, will be stood down without pay. Those in lockdown areas will need to apply to Centrelink for the regular coronavirus support payments. Employees who live elsewhere will receive a new $750 a week federal government support payment for aviation workers,
which we will pass directly on to those individuals that are stood down.
There are concerns staff like baggage handlers could miss out altogether.
There'll be well in excess of 10 or 12,000 workers that have fallen into a hole here, a black hole.
Unions say the support package adds to the $1.6 billion taxpayers have already spent on keeping Qantas afloat.
The tourism industry is affected. The support should be available to all workers affected. And this is true beyond tourism. This is why we need JobKeeper 2.
Qantas says the staff should be stood down for about 2 months and isn't expecting any further job losses. However, that depends on how long these lockdowns last and when states reopen borders.
There's a lot of uncertainty out there on that.
An industry's future that's up in the air.
Well, of course, when you look at that, so if we don't do the right thing, this is what it results into. So many job losses and tens of thousands of people. This is 2,500 that have been stood down by Qantas, but by far there's lots more.
Yes, lots more job losses will be looking into that as well. A lot of people are suffering. If these lockdowns continue, then the planes can't fly or nobody can have work at all. So people be safe, keep Australians safe and do the right thing.
And it is about doing the right thing. If we don't, then we will be stuck in for longer. Right now, what's the modelling? How do we get out of this? Do we have a pathway out of this situation?
The Commonwealth cars are fewer in number. The halls of power eerily empty, as lockdowns and border restrictions keep many MPs away from COVID-free Canberra.
Honourable members, the Speaker. The Prime Minister had 2 jobs this year and he failed at both of them.
But inside Parliament, the politics of the pandemic are now more contested than ever before.
Anyone who thinks that the Prime Minister only has 2 jobs is not up for the job, Mr Speaker. He's not up for the job.
Labor is proposing cash for vax.
The opposition returned from the winter break with a populist headline-grabbing plan.
Anthony Albanese proposing a $300 payment for all Australians who get vaccinated by December 1st.
Think it's running hot? You're right.
The perfect fodder for breakfast TV and radio, it was designed to focus public attention on the problem-plagued vaccine rollout.
John says Albo's channeling Oprah. You get 300, you get 300, everyone gets $300.
We know that this would provide a discussion point.
It's not a discussion the government is keen to have. The idea won't be implemented.
Frankly, it's a little bit insulting to the many millions of Australians who know the best way and reason to get a vaccine is because it protects their lives and those of their loved ones.
We have an order. 1, 2, 3, 4. Yeah, go on.
But for an opposition that sometimes struggled to get any airtime, it served a purpose. For once, Labor spent the morning the centre of attention.
Perhaps they don't reckon.
As they said, that Labor did get a bit of airtime there, which is always, they're scrambling to get airtime, but, what a way to get an airtime. And of course, as many people have said, that, people will do the right thing. It's the right thing is to get vaccinated. We all know about the shortage of the vaccines and the rollout. But anyway, everyone's moving in and doing what they can. Well, I'll move straight on to the next because I'm also mindful of the time. Looking at the young people and how they have become vulnerable as well.
I mean, a thing that I think is not completely grasped by a lot of people is that people vary hugely in how much they have the potential to transmit the virus. Different person to person, but one of the major factors is age. And so we know that there's really 3 different broad age groups. There's the older people who don't really have that many contacts but are really susceptible to transmit the virus. There's the young people who have quite a lot of contacts but aren't that susceptible and aren't that likely to transmit it to each of those contacts. And then the people in the middle, working age, but particularly at the younger end, they really can get the virus and they can spread it on and they come into contact with a lot of people in the workplace. And really the fact that they're mixing with other high-risk, high-transmission people in the workplace really amplifies that. So looking at that, up till now we were always told that the young ones are immune. It's mainly the elderly who are at risk. But as we've seen that this Delta is something else.
Yes, absolutely. I mean, it's not leaving even the young ones. 9-year-old children are having this virus as well. So that's why everybody needs to do the right thing. And I don't believe bribing or giving $300 for vaccination is a good idea. It's the responsibility of individuals to get vaccinated and to keep their families and Australians safe. So it's not a matter of giving $300 for each vaccine. It should be responsibility of the people, individual responsibility to keep Australians safe and their families safe.
Well, of course, that is quite true as well. Right now, moving on with the next news which we have is right here from Brisbane as well. I am also part of the Vilification Act Reform Committee, and we have all been, lobbying hard, and we've had our first hearing, but there have been cases of, lot of racism, and of course there has been vilification. And right now the good news is that Fraser Anning has been ordered to take down posts of vilifying Muslims. Here's that report.
For these young Australians, slurs against Muslims on social media are no game.
Some people say words can't hurt someone, but it's not true.
Especially when those hateful words come from an elected representative.
I don't think Anning represented anybody. To be honest, I would like to call him an accidental senator. That's what he was.
In office, Queensland Senator Fraser Anning copped public hits for his anti-Muslim comments. Now he's the first known Australian politician who's been found to have unlawfully vilified some of his own constituents.
Politicians often think that they have free licence to say what they want, and that can really embolden people to attack people from migrant backgrounds on the street.
In a landmark win for Muslim advocates, the Queensland Civil and Administrative Tribunal has ordered Mr Anning to remove 141 online posts. They include his infamous comments blaming the Christchurch massacre on Muslim immigration.
This is a moment where we can say to politicians in Australia, there is a line, please don't cross it.
What we've seen here is that a politician who made these comments while he was a senator, while he was an elected member of the Australian Parliament, can still be held to account. It's really significant.
Fraser Anning failed to appear at the tribunal and he couldn't be reached for comment. The posts are still online. The former senator has until August 27 to delete them. For now, anti-discrimination laws have laid down the community standard for those in power. Josh Robertson, ABC.
And that is a good win for the committee. And as we know that this kind of acts is just not acceptable today, and even though he is not a senator anymore, but he can still be held accountable, and he still has to delete those posts that he's put on there, and let that be a lesson for others as well. I think this is a community, and we are a very proud multicultural nation, and we should all be working together.
Yes, we should be all working together, and there is no place for discrimination. So that's the thing that Queensland or in Australia is a multicultural country, and there shouldn't be any discrimination at all.
Well, our lead-out story today is Olympics, and as we know that Australia has done really well. Fiji has done quite well as well, and Indonesia for the first time, has won gold medals. And the people who the team have been given free houses, 2 cows each, and the meatball factory as well. So the government's really pleased with their outcome, and they're doing the right thing there. Australia has done very well. Fiji, which is a very small island nation struggling with COVID at this point in time, has done wonderfully well, and so has India. Here is Chief Minister Naveen Patnaik.
Congratulations, India. What a terrific game our women's hockey team played against Australia. Keep it up. The best of luck.
Well, let's talk about some of the functions and events. The first I want to talk about is, it has just come through now, and thanks Devika for sending that through. And it is from Sri Vishnu Maya Mandir, Sri Krishna Janam Ashtami by His Holiness Dharam Guru Pandit Tripathi Ji, from Monday 23rd August till Monday 30th of August. So, of course, the timings will be dependent upon the beginning, because which is 23rd. By that time, we should really be out of this lockdown. So the timings are Monday to Friday 6:30 p.m. onwards, Saturday and Sunday 5:30 onwards, and food will be provided on a daily basis. Havan will be performed on Saturday 28th at 5 p.m. Sri Krishna Janamika Janam and Utsav at 8 p.m. on Monday 30th of August, celebrated with Kirtan, Sohar and Garba. Then Bhog, Aarti and Mahaprasad. If you're wishing to sponsor the food, it is $400. No fixed sponsor for Havan. Donate as you wish. For further information, you can contact Dhiru Desai 04062 13153 or Devika Maharaj 042489111 59. So thanks, Devika, for sending that in. And as we have been making announcements that many of the functions and events have actually been cancelled. And one of the one that's been cancelled or put on hold at this point in time is India Day Fair. And to talk about that, we have Usha Chandra in the studio. So what's happening with India Day Fair?
Thank you, Umesh. I mean, our iconic India Day Fair celebrating India's Independence Day is postponed to another date. As soon as we get the notification from Suncorp Piazza, we'll be announcing the new date. So we would like to thank all our sponsors, all our performers, our parade people, volunteers, and all our team members as well. Thank you so much for helping us out, but we will be in touch with the new date. So we would like to, we have already postponed India Day Fair, the iconic Independence Day. So, and we have, I think we have got a few other programs postponed as well, which Umesh will talk about.
Yes, we know that many events that have been cancelled or put on hold is Lalita Kalyala's function, and of course we have had the Sargam Music and the event, all the events. So that's why we are not running the event section at the end of this news series at the moment, because we're still trying to gather all the information. Maybe from tomorrow we'll start running them again, but with the new dates, if they have already found the dates, we've contacted all the organizers, and it's on the topic of India Day Fair. It has been done in the community interest, following the the directive and directions of Queensland Health and Queensland Government, and in the safety of the community at large. It was decided to postpone it in the best interest and in the community health segment. So we could push ahead and go, and we might have had to hold it on with a less number of people, but that would not be the right thing. The right thing to do at this time was put it on hold for the time being, and follow the direction of Queensland Health. As we know, we've seen Dr. Janet Young struggling there to try to contain this outbreak of Delta. So we, as a responsible organization, had to take that decision in the best interest of the community at large. So, be rest assured that we will bring it to you in a bigger and better manner, which is giving us a little bit more time. As far as our advertisers and sponsors are concerned, they're all very happy. They will get a little bit of extension of their promotion. So we will do the right thing. And ever since we put on a post on our social media announcing the postponement, we have received very positive feedback that this is the right thing, and everyone saying that GoPure Queensland has taken the right decision to postpone it, because it is in the interest of the community and looking at the community health. So doing the right thing. Like now we've seen people going out, which is not the right thing. So that's why it is always good to do the right thing.
Do the right thing, yeah, and thank you so much for having me on the show, Umesh.
And wonderful to have you on the show as well. And people, did you like having a co-host? I think that's a very good idea. If I can twist her arm to get her in there again, we will. Thank you so much, ladies and gentlemen. That's about all we have for you in this segment. We will, don't forget that tomorrow we have the travel updates with Tanvi Goyal of Oz India. And on Friday, we will bring to you what the Olympics announcement is going to do to the Brisbane real estate market. And that is by the chief economist of PRD research team, Dr. ST. So, she will be here discussing all that. And of course, on a daily basis, there's one studio guest which normally comes in, at these days. Most of them are coming in via the video link as well. Usha is a different case as well. She's a special, so she's here in the studio with us. So until the next bulletin, it's goodbye from us.